Hello there, welcome to another episode of the annual 30-day career boost initiative for the African youth. I am Abigail Oyedokun, a final year medical student, also a social impact innovator and an advocate of SDG 3, good health and well-being. And yes, you guessed right, I'll be talking about health today. And just before I start, I'd like to say a big thank you to the InStride Pathways Youth Foundation for this wonderful opportunity, even to explore such a topic today. And I hope you listen well and flow along with me. Healthcare. Healthcare is very vital to every aspect of our lives, and it's very important, as we all know. It is important as it goes beyond the individuals to affecting the society and the world at large. So it is important that we discuss global healthcare because it is vital to the societal well-being. And as part of our topic, it is very important that we talk about universal health coverage, because we can't talk about universal healthcare without universal health coverage. So what is universal health coverage? Universal health coverage is a system in which everyone have access to the health services that they need without experiencing financial hardship. So it is just in a way to help to promote accessible, affordable and equitable healthcare for all. So it's banking on two things now, the access and the financial implications. So if the two are not constantly present, we can't say we have universal healthcare. I mean, if there is no access, let's say in your environment, you don't have the facilities to access the amount of healthcare that you require, or when you access them, you experience severe financial hardship, then we can't say there's universal health coverage. So this is what universal health coverage is about. So we want healthcare to be available for everyone and also to be affordable, that is, they're able to afford it. So is it a realistic goal? Yes, it is, and it is a realistic goal for global health equity. Topic is vital for every African youth, regardless of whether you are in the health line or not. So you might be wondering, oh, I'm not a medical student, I don't work in the health line as well, so why should I learn about healthcare? Yes, you need to learn about healthcare, because universal healthcare cannot be achieved without everybody pulling their weight and coming together to achieve it. We need leaders, we need health advocates, who don't necessarily have to be people in the health line. So every one of us, because this is something that affects us, this is something we all need access to, we need to work together in order to achieve universal healthcare. Now I'll be talking about the components of universal healthcare. So I think I've talked about some of them before. The fact that everyone must be able to access this healthcare before we say it is universal. Apart from that, there's also need for financial protection, which I've talked about, which means you don't have to go into poverty because you want to take care of your health, right? So apart from that, we also have comprehensive healthcare. So what do we mean by comprehensive? Comprehensive in the sense that it must have all the components of managing health, to start with prevention. So prevention of diseases such as in form of taking vaccines, health education, counseling and everything must be available to everyone. Apart from that, curative treatment, so such as going to the hospital, you being treated, giving medications, surgeries being done, different interventions just to treat a condition and bring you from a place of illness to health. So this must also be present. That is the second component of the comprehensive healthcare. Apart from that, we also have rehabilitation. Yes, there are some conditions that might not be necessarily treatable, but rehabilitation should be done such that the person can be brought to the point where they can still function well without, in a place where if this intervention is not given to them, they might not be able to even function at all. So being able to restore some sense of functioning even despite an illness being present. So we must have this as well. Apart from that is the palliative treatment. So there are some conditions that maybe like all terminal diseases like cancer and some other diseases that might not be necessarily treatable at some point. Maybe it has already advanced and gotten to a stage where nothing much can be done. There's still need for palliative treatment, palliation in the fact that the person can live the best possible life before they die, right? So this is why universal healthcare is an important conversation, because if we go to communities, especially in African communities where universal healthcare is a major challenge, you will notice that one or more of the components of this universal healthcare are missing. If it is not that it is not accessible to everyone, in the sense that maybe if you don't have enough money, you cannot maybe access it, or maybe it's for just some set of people, or maybe financial protection as well. Maybe when you see people because of poverty, they cannot afford healthcare, and some people in the course of treating an illness, they fall into poverty. So yes, that is also another issue that we might have noticed. Also, the components of comprehensive care are missing in many communities today. So I'm sure many of us are only aware of maybe preventive and curative treatments, especially if it goes on underserved communities like villages and all those places. You notice that you might just have maybe the prevention, maybe they might do some health talk in their primary health care centers, maybe they can access some curative treatments, which might not even be total. Some have to travel so many long distances to get definitive treatments like surgeries and some other things when they are coming from villages and rural communities. Apart from that, rehabilitative treatment, because of different norms and even availability as well, you notice that many people don't get access to rehabilitative treatments. In addition, palliative treatments are also restricted most times to urban centers, which are also few that cannot even serve those places yet, not to talk of people coming from all over to come and access them. So this is to tell us that we still have a long way to go in Africa and even in the world if we are going to say we are achieving universal health care. So if this is not addressed, you notice that there are a lot of consequences that are usually coming with it, and some of them are already evident in our communities as we speak. So some of them, like malnutrition due to poverty, when people cannot even afford food, they cannot prevent diseases because there's malnutrition and the children tend to fall sick faster. We also have it affecting education. So a child that is sick, that cannot go to school tomorrow, the child has yesterday the child has malaria, tomorrow another infection, and so many other things, they will not be able to go to school. There's chronic absenteeism in school, and definitely this will lead to what? To lead to them performing suboptimally. Apart from that, we also have the economic impacts. The economic impact is the fact that when people don't have access to healthcare, their conditions progress to worse states, and this affects them because they have to even spend more. Still on the challenges, we also have the challenges of what? Cultural barriers. Cultural barriers are a reason why universal healthcare have not been achieved as well. In a lot of communities, we have our beliefs, we have our traditions, things that maybe have been working before the modernized healthcare came into place, and many people still rely on these means to get better. Even when they have access to healthcare, some people will still decide that they want to follow the traditional pathway. Some of them will still want to go to traditional homes to deliver their babies. They still want to use the herbal medications. They still want to do those various procedures that are not scientifically tested. So cultural barriers are some of the things that affect healthcare, universal healthcare being achieved. You see some people, when they are even on admission, maybe the doctor is telling them this condition needs to be managed for months before you get better. They lose patience and they even decide to go to those traditional homes just to get treatment. So this is to tell us that it's not just about maybe the cost or maybe it being available. Even in some cases where they are available, people still don't use them. There are a lot of facilities available today that people don't use because they have cultural barriers to it, beliefs that they have, cultures that are around. You see some communities, the women cannot even go to clinics except their husband permits them. So imagine maybe something just came up, the child just started feeling ill, and the mother cannot make the decision even to take the child or herself to the clinic without the husband saying, okay, you can go. So there are a lot of cultural barriers that are around, that even in Africa, that prevents us from maybe having this universal healthcare being achieved. So this is to tell us that a lot of norms and tradition needs to be addressed, even when these facilities are put in place for people to be able to access them. Another barrier is also religion. While religion is good, we also have a lot of people who have hindered themselves from getting access to healthcare because of religious beliefs. And a specific example I'm going to give in this regard is for mental illnesses. A lot of people have attributed mental illnesses and some other conditions to being entirely spiritual, and they feel, they have to take the person to the church for prayer and other places just for them to get help. And when you talk about psychiatric provisions available, they don't want to go for them. They feel, this is not natural, this is beyond the physical, and they have to seek spiritual help. And the advocacy that we do in health currently is that while you are accessing your spiritual help, you should also couple it with medical help. While we are not saying neglect spiritual help, don't get me wrong, we are also saying that you should seek medical help. A lot of conditions can be managed just by taking one single medication, taking this tiny dose of drug there, and you are going to get better. But because of this belief, these people decide not to go to these centers despite being available to them. So this is also one of the major barriers. Apart from that, we also have political barriers. There's no way we want to talk about healthcare challenges in Nigeria that we don't talk about our leaders. Yes, we have to talk about them because they drag the budgets, they map out where the infrastructures are built, and a lot of other places. And I'll give some examples here. A lot of people in Africa complain about corruption, and also the fact that even the resources are not evenly distributed. There are lots of times healthcare doesn't get the required amount of funding that is needed. So this also affects how much of output that can come out from healthcare in different communities. One of the consequences that can come with it, apart from that, you have mobility. When we talk about mobility, is how it can affect the person. So you can have disabilities from conditions that could have been avoided. So someone can come down with an illness, something that they are not supposed to have if they had gotten treated early, and might end up with it. Apart from that, people can die because of these illnesses. So this is why we must all rise up and ensure that we put our hands together as the future leaders of Africa and even the world to ensure that healthcare is a priority. Healthcare is something that we constantly discuss in the top tier seats where we find ourselves, to ensure that the world comes to a place where everyone has easy access to the right amount of health services that they need. So apart from that, a lot of resources regarding healthcare are concentrated in urban centers. So if you look at maybe a region or a state, for example, there will be some top and prominent hospitals that are very distant and far from rural communities, from other communities, that when people want to access these places, they have to travel over rivers and roads even to get there. So this affects people's access to this healthcare. Why not build some of these facilities in rural communities where other people can also access them? So also the distribution of healthcare professionals. So definitely when the facilities are concentrated in the urban regions, health professionals will also be concentrated there. So apart from talking about structural barriers, so the way the programming is done, so there are structural barriers in the fact that the way, let me use Nigeria as an example, we have the primary healthcare, the secondary level of healthcare, and the tertiary level of healthcare. So normally there are some conditions that are supposed to be treated in the primary healthcare and everything like that, but currently there are structural challenges such that even conditions that are supposed to be treated in the primary healthcare center are now being taken to the secondary healthcare center and even the tertiary healthcare center, making the tertiary healthcare center being choked such that there are now a lot of patients that are not even supposed to be visiting this center, affecting other people's access to healthcare. That means people that are even supposed to be going to this tertiary healthcare center with more significant health crisis cannot go there, because the amount of patients that are supposed to be visiting primary healthcare center that are not going there are now in the tertiary healthcare center. And you won't blame anybody, because a lot of our primary healthcare centers are not well funded. So people are scared that they will not get the best health services that they can get in those centers, which is why they go to the tertiary ones. And yes, the ripple effects and the challenges continue. Moving on, we can't finish this conversation without establishing that universal health coverage is a reality. Yes, you might be thinking that, it's not possible, it's not possible to have that, you can't do that. Yes, it is. It is actually, because there are some countries that have experienced that and are currently experiencing it. I give you an example, like Netherlands. In the Netherlands, they have universal health coverage. They are one of the countries in the world that has universal health coverage. We also have countries like Norway and some other countries. And as you might have seen, I've not mentioned any African country. So in the Netherlands, you have the structure there is that there is provision for all. There's provision of healthcare for everybody, regardless of your level of income, regardless of where you are living or where you are coming from. Yes, they might have little challenges here and there, but that provision is there. Apart from that, every working adult has insurance. So unlike in Nigeria, where there are a lot of adults that are not under any insurance policy, every working adult must be under insurance, such that they only pay small money out of pocket for treatment when they fall sick or when they are healed. They also have very effective taxing system there and a lot of other things like that. So this tells us that if some people have achieved it, it is not an impossibility. Apart from the fact that some countries have achieved it, there are also advances in technology today that can bridge a lot of the challenges that I highlighted earlier. So something like inventions of drones, of artificial intelligence, telemedicine, which means you can be in your rural community and a doctor somewhere far away can attend to you over the phone, even though it might not be 100% effective, but it can solve quite a number of problems, or the person can just tell you the little interventions you can do before you get to where you get the appropriate treatments, right? So this is telling us that a lot of these challenges, we can tackle them. So achieving universal healthcare will start from us addressing all these challenges that have been highlighted. To finish up with this conversation, it is important to talk about our role as youths in ensuring universal healthcare. So you might be thinking that, how does it matter to me? Why does it concern me? Yes, it concerns us. I think from everything we've been saying, you should be able to discover by now that it is not the job of one person or the government or healthcare professionals. It's the work of everyone to ensure that we have this. So, and as youths, how can we ensure this? What is our role in achieving universal healthcare in Africa? The first thing I'll be talking about as in our role as youths to achieving universal healthcare is that we have to be leaders. Youths, we have to be leaders. I'm talking to you and I'm talking to myself. We have to be leaders because a lot of these challenges I've highlighted today, if we are in the right places to be able to influence decisions, we can correct them or move the countries that we are in the direction of change. So we need to be what? Leaders in the little places, in the high places, in the public places, not just in government. There are other agencies that we can work in and lead, and places where we are stakeholders to making change. So this is why we have to be leaders. This is our primary roles as youths, and we are the future generation of leaders. So to be leaders is not just when you get to those positions. You need to start learning about leadership now. So this is why you have to put yourself in capacities where you can be trained to be a leader. Maybe in that your little department in school, maybe in a social setting, maybe they just need someone to head the place. So we start from the little places, training ourselves to become leaders, and such that in the nearest future we can take up leadership positions that can influence health, decisions, and can help the situations to become better. So this is a wake-up call to everyone that leadership is not just for a set of people. We all have to be leaders. Another way in which we as youths can influence universal healthcare achievements is by taking up careers in healthline. So be it being a doctor, a nurse, a physiotherapist, a pharmacist, a medical laboratory scientist, a radiographer, and all other professions that are linked to healthcare and public health. So these are one of the ways in which we can help to ensure this, because if we look at Nigeria, there are a dearth of healthcare professionals, and also I wouldn't like to ignore the fact that this is also owing to the fact that a lot of professionals are emigrating, and while we are looking up to the government to ensure that the system gets better, we also need more people coming into the system as well to ensure that things get better. If you look at specialists in different, there are very little specialists in a lot of departments in medicine. So something like neurosurgery, something like orthopedic surgery, and a lot of specialties. There are a dearth of professionals. So, and if more people don't come into the system, there will be reduction in even those that are currently there, and this will also affect us achieving universal healthcare. So before I move away from this point, I also like to say that it's not everybody that has to be working as an healthcare professional to be able to influence health. In fact, we need people from other professions as well. Let me give you an example. If you are a lawyer, for example, you can defend people's legal cases in court to ensure that universal healthcare is also being encouraged. Apart from that, if you are a policy advocate, you send policies to the government to develop policies. You can also develop policies in line with healthcare, right? And it also affects the decisions. If you are a teacher, you can also educate students. You build the future healthcare professionals. You teach them, because definitely everybody needs the basic knowledge. So this is one of the ways in which we can also serve as a promoter of universal healthcare. If you are a banker, you can help people manage their funds, even help insurance companies establish appropriate plans, even for people as well. So this is another profession in which we can work in universal healthcare, and most importantly, in the line with technology. We need engineers, AI developers, and a lot of other people, in which majority are youth today, that can help develop different things that can help healthcare in Africa. I'll give an instance. I've heard of an innovation in which drones were produced, in which when there's need for blood in a very rural community in that country, the drones can carry blood from an urban center and take it and fly it to the urban to the rural area, and that will help them to speed up whatever surgery they are doing or whatever intervention they are giving to the person. This sort of intervention cannot be achieved by being a doctor or by being a nurse. You need people that are very skilled in technology in this direction to be able to influence this. I've also talked about telemedicine. So if all these innovations are not being put in place actively, there's no way we can achieve universal healthcare. So this is why in all our different professions, be it medical, paramedicals, or non-medical professions, we have our own inputs, we have our own contribution even to health. And even if you are a politician, yes, this even bears more on you, because you are in a position in which you can directly influence the financial input into healthcare and a lot of other things like that, and also decision making, infrastructure development and all. So this is to tell us that we as youths, to ensure that we get into positions, into careers that can help us to influence health. Maybe we've not started working, a lot of other things I talked about might be your own future goals. Right now, what are the things you can also do as a student? You can volunteer. There are a lot of outreaches out there by non-governmental organizations that will say, oh, we are having a pink walk for health, for instance, we are sharing this to this community, we are going to tell them about vaccination, we are taking vaccines to this community to give. As a student, you can volunteer, whether you are a medical student or not, whether you are working in the health line or not. You can go for such outreaches. You can lend your voice to talk about, oh, maybe the stigma about mental health, maybe the stigma with sickle cell disease, and a lot of other things that all of us working together can help us to advance healthcare. So these are some of the means in which you can improve healthcare even as a student. So we should volunteer for outreaches, we should donate even to initiatives that are advancing this, so and ensure that we give all our talents into it as it may apply. Social media is there as well. In this generation, we know social media is a very effective tool to influence people's decision. You can make a post online, that little post out there, that little message on Instagram, that little post on LinkedIn, that little post on Twitter can help to build more conversations that will lead to people being informed to make the right decisions about their health. Apart from that, health campaigns. So we should go out there and do a lot of campaigns for people to know that, oh, for instance, maybe insurance. A lot of people in Nigeria still have the wrong notions about insurance. So people still don't even they pay all their medical bills out of pocket. So we should also involve ourselves in health campaigns. So we go out there into communities, champion health campaigns, tell people about their health, tell people about different things like that, and also starting with ourselves. There's no way we can talk about universal health care for all without starting with ourselves. We are also a person in ourselves, so we have to start from ourselves. Do you take care of your health as a person, as a youth? We are not talking about universal health coverage without talking about you as a person, because you are also very important. You take care of your health before you tell other people. Actually, are you taking care of your own health? Do you have insurance, or do you have insurance plan in the future? So these are the ways in which we as youths can also help the achievements of universal health care. In our taxes, some of us might be working or will be working in the next few years. We should make sure that we pay taxes. We do all these necessary things to generate revenue for the government to be able to improve on the healthcare system. As youths, we have a lot of role to play in achieving universal healthcare, both now and in the future. So we should try our best to make sure that all these things are highlighted, we involve ourselves in them. Apart from that, learning is a continual process, and is a very important topic in this discourse, because all of us need to learn about health in any place we find ourselves. So we should also learn about health. That little article right there about health, that thing that they published out there, because we've also noticed that a lot of people these days don't pay attention to health information. You might see maybe they're saying, oh, today is World Suicide Prevention Day, and there's an infographics on Twitter. Do you actually read it? So we shouldn't let the efforts of people like trying to promote healthcare and every other thing getting frustrated or not being effective. Let us have a learning mind, a learning heart. So when something is posted, be inquisitive to learn about it. Whether you are in the health line or not, let us check all these things and educate ourselves. These are the ways in which we can encourage universal health care. So by reposting that post right there, by sharing that post to a friend, like I've said earlier, these are our roles in promoting universal health care. So we should ensure that we use all the available resources to us as students, even right now, to ensure that we advance universal health care. In conclusion, I believe we've learned one or two things today about universal health care and the importance. So you will agree with me now that in Africa, in Nigeria and other African countries, we have a whole lot to do, and it rests on you and I. It rests in our hands on we achieving this goal, or we promoting universal health care and seeing it to the end in the nearest future. Because healthcare is not a privilege, it is actually a human right, and everyone should have access to it. So thank you very much for listening. I hope that you've learned one or two things from everything that has been said. I know that we've said quite a lot, so I hope that you've learned one or two things that can help you to be an health advocate out there, to be someone to champion something in the direction of achieving universal health care. Thank you very much for listening, and tune in for the subsequent sessions as well.